Welcome to this National COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Mr. Noble Maungwa is with me on the sign language desk. The past few weeks have seen the country experience a decline in the number of new COVID-19 cases recorded per day, a clear indication that the third wave and the pandemic is being brought under control. Unfortunately, complacency can easily derail these gains. So what are some of the key issues that we need to pay attention to in order to address this big complacency challenge that the country is currently facing so that we remain on the right path? Complacency is basically a feeling of pleasure or security about a situation, coupled with the fact that one does not feel the need to do anything about the situation, even though the situation may be uncertain or dangerous, like COVID-19. Many individuals in our communities are feeling secure about the steady decline in the recorded new daily COVID-19 cases and deaths, and do not see the need to continue to adhere to prevention measures. The danger, however, is the potential resurgence in cases. Lessons learned from the first and second wave tell us that the pleasure or the security that we are currently experiencing as a result of a steady decline in new COVID-19 cases can be overtaken by a fourth wave at any time. So once again, what is it that we need to look out for to ensure that we can indeed continue to feel good and secure about the progress we have made, but also remain vigilant? First, it is important that we stay up to date with COVID-19 statistics in our communities, our districts, and our provinces. Simply focusing on the national numbers and feeling very secure and happy about this is good, but not good enough for you as an individual and as a community. Seek updates of local statistics from your local health team members, such as your provincial medical director, the district medical officer, and the nurse at your local clinic. This simple but very important action can help you keep motivated and appropriately informed, and hence help you and your community take appropriate action and avoid this complacency. In addition to paying attention to local COVID-19 statistics, the second issue we need to pay attention to is on general COVID-19 activities in our communities. These can include the funerals and the opening of new vaccination centers, for example. This critical local information can influence how you protect yourself, your family, and those around you. Make it your point to stay well informed. Look for correct information from reliable sources such as the Ministry of Health and Child Care. The third issue that can help you minimize complacency is to come up with innovative ways of implementing the same old prevention measures. We are all aware that doing the same thing over and over again can be boring. Introducing a new and different washing or sanitizing container at the entrance of your home or your business, a foot pedal operated sanitizing bottle versus your usual hand spraying bottle can help. If you have children, get them involved when you introduce these new changes. This can go a very long way in keeping the whole family motivated in order to adhere to COVID-19 prevention measures. The fourth and perhaps the most important issue is not to be afraid of upsetting the status quo or of potentially disagreeing with your family, friends, or colleagues for doing or saying the correct thing. Do not worry about what others will say. If you, for example, know that there is no social distancing at your uncle's funeral and you therefore choose not to attend the funeral, this decision can save your life. Remember, it is not important to always agree with everyone. What is important is to always do the right thing that can protect you and your loved ones, as well as your community. Finally, let us strive to break the now so familiar cycle of successfully controlling one wave and finding ourselves hit by another wave, mostly due to complacency. Let us adhere to the recommended prevention measures all the time and not some of the time, even when the number of new COVID-19 cases recorded per day is going down. Adhering to all the prevention measures includes getting vaccinated. Thank you.